Good afternoon, everyone, and welcome to our Protect Our Province COVID-19 briefing for Alberta on Wednesday, January 5th, 2022. We are live streaming from the traditional and ancestral territory of many peoples. We are grateful to live and work in Alberta, a province on the traditional territory of 48 different First Nations and the unceded homeland of the Métis Nation. Today's conversation is being shared in ASL. To ensure access to completely accurate information, closed captioning will be uploaded after the live stream is complete. This conversation for the public is being shared live on YouTube, Twitter, and Facebook. The Protect Our Province COVID-19 briefing is a regular panel of doctors and experts. We will endeavour to bring you timely, accurate updates on the COVID-19 situation in Alberta and take questions from the public and the media. The views of our panelists are their own and do not represent any institutions they may be affiliated with. We have collectively gathered here as concerned Albertans, attempting to ensure that everyone in the province has access to as much information concerning COVID-19 in Alberta as possible. As always, we will start things off with an update on the COVID-19 situation in our province. Welcome, everyone, to our first broadcast of 2022. Simultaneously, so much and absolutely nothing has changed since we last gathered. Last week, Alberta parents and educators learned that winter break would be extended by an extra week under the guise of making schools safer for our youngest Albertans to return January 10th. A narrative we've heard before, but a story that has yet to find a chapter that sees safe practices integrated into our classrooms, and I am not convinced this time will be entirely different. I would like to start off by saying that the POP Alberta team believes in-person learning is best for tiny humans. We know in-person education allows them the opportunities that cannot be matched in this digital format that I am currently meeting with all of you on at this moment in time. But we do question, and what we really keep asking is, what is the government doing to make that safe? And what could they be doing, which I think we're going to hear a lot about today, is a fair bit that they're not doing. So before we start our conversation into back to school, I would like to bring up Dr. Jo Vipond into our conversation to share an update on Alberta's current publicly available numbers. Dr. Vipond, happy 2022.
And to you, Michelle, and to all of Alberta. I just got back from a shift in the Emerge, and man, it was jam-packed full of COVID. I fortunately didn't admit anybody with COVID, at least not that anybody had tested positive prior to visit, but I saw some pretty sick people and some people who are really distressed by what they're going through. Really challenges this narrative that Omicron is mild and that there's, such thing as a mystery illness that no one's ever seen before that we can feel relaxed about. This is new. This is new to everyone. This is not your mother's or even your older selves COVID. So it's a strange time we live in. But on to the numbers. So our numbers yesterday, 4,768, which is a 69% increase over last Tuesday's 2,823. So that's a pretty massive jump again, week over week. And of course, that's nowhere near representative of what the actual case numbers are out there, because a lot of people are doing RATs at home, rapid antigen tests. Those are not being reported to the government. So this is just a very poor, fuzzy, pixelated picture of the actual landscape on the ground. And you can also tell that by the test positivity, which is 36.92% yesterday. That is a new pandemic record, besting yesterday's pandemic record at 36.20%. So just a little bit of a 0.5% above that one. And also to remind people that last week at this time, it was 30.08%. So now we're back into regular testing. It's no longer the holiday period. I would have hoped that those numbers would be dropping, but they are not. Hospitalizations. Well, I've talked about this before, how the numbers get revised all the time. So the actual number the reported number for yesterday is 398. And that is only up 7 from the day before, which is 391. But the number we reported yesterday was 375. So it was revised from 375 yesterday to 391 today. So you can see that as those revisions go up, it looks like it's not going up that much. Oh, it's only up 7. But really it was up from the reported number yesterday of 23. So that's a huge jump. And speaking of huge jumps, we've gone from 62 ICUs to 72 ICUs for this quote-unquote mild disease. And of course, 11 mild deaths reported as well. Those mild deaths were amongst a 50-year-old, 2 60-year-olds, 4 70-year-olds, and 4 80-year-olds. And of course, I'm facetious in the use of the term mild deaths because, of course, there is no such thing. We haven't had a report, a Protect Our Province Alberta report, since the reported pediatric death yesterday. I want to take a moment to pause for that little one who I feel we failed as a province, and I wish I could have done more as an individual to protect him or her. The other thing that I don't have today is the breakdown of the admits, but I can tell you in the 7-day period from December 29th, 6-day period maybe, from December 29th to yesterday, there were 31 pediatric admissions to hospital. Never mentioned by Dr. Hinshaw yesterday or Dr. Hinshaw today. I think we need to draw attention to the fact that there were 31 pediatric admits. You can look at my tweet thread to see the breakdown of the day, the ages. There were 2 ICU admits in that period as well. So on to school, I guess. I think we have a lot to talk about. I don't want to preempt this conversation, but just to say that we continue, although our government continues to say that it's airborne transmitted, we have no acknowledgement of that by the government in their policies. And therefore, if you do not mitigate the right form of transmission, you will fail. You can deep clean all you want. It's not going to make any difference in these schools to these kids because it's not transmitted by contact. So you've got to have airborne precautions, and I'm sure we're going to talk a little bit more about that. So I'll turn it back over to you, Michelle.
Thank you very much, Dr. Vipond. With us again today is Dr. Wing Lee from Support Our Students Alberta, an advocacy group that has been working tirelessly to keep parents informed about school cases of COVID and lobbying the government to implement effective mitigation measures. If I could speak, that would be great. Welcome back, Dr. Lee. Thank you so much for giving us your time again today to talk about where things were when we left in December, and from your perspective, whether or not we can expect any positives to come out of what has been announced over the last couple of days.
Thanks, Michelle, and good to be back here, though I wish that the story would change for once. So for those who were listening to the education minister just previous to our streaming, she did announce that Alberta students will be going back in person starting Monday, January the 10th, just a few days away. However, the problem is we did not hear any meaningful acknowledgement or addressing of how little the government did, in other ways to mitigate airborne transmission, which Dr. Vipond touched on. What I want to do today, because we have the focus, of the public discourse, schools are imminently restarting. I really want to reset the narrative, because listening to, Dr. Hinshaw and Minister LaGrange over and over again, you kind of forget how much they've eroded from what would be a safe, comprehensive package of tools. And so I'm going to take some time and go into just the basic advocacy points of what we and other advocates have joined in chorus saying we need layers of mitigation. So whenever you're ready, I have some slides here to take everyone through what a safe school reopening should look like. And many of these points are upcycled because we keep saying every time schools come back from holiday or from a closure, we need comprehensive, multi-layered approaches. So next slide. So here we are historically, if we want to situate ourselves in the context, this is actually the third school year. If you remember, the very first school year, schools closed in March and never opened again for that very first. The pandemic started up in 2020, in the spring. And then we have, journeyed on this roller coaster of waves. We had the fall wave of 2020, and then we had Alpha in the spring and Delta this fall, and now we have Omicron. And what have we learned is that this government has not done enough, and every school closure is the result of unmitigated spread. Next slide. So we have the tools now. We have navigated many, many months of schools, pandemic, what we need to add to the mitigation package. But what I want to reiterate is that Alberta invested among the least for safe school protocols. So when government says we're following in line other provinces, we actually don't measure up in terms of proactivity and direct funding targeted for protocols for COVID. So these have been bare minimum. And what's actually been happening since the summer of 2021 is we've lost actually some of these default basic measures. So before I go into the list, I think we need to reiterate that this is because of lack of political will. This is not because we don't know what needs to get done, but we need centrally funded distribution of safety measures that are universal to all school boards. And the tools have to be layered and multi-pronged. What's happening right now is that we get one measure and we have others taken away. So rapid tests are coming, but now we no longer have access to PCR testing for schools. So how will we get notification? And I'll go into that into a little more detail. The other aspect I want to bring up that the government continues to neglect is including the excluded voices. So when schools are delayed, they did have a plan for children with complex needs that access resources at school. They've lost out again on being at the table and being included in these conversations. So now that schools are reopening, we have to address that there are many communities out there that this government has not only not listened to, but have taken resources away from. So this is a little overview. Next slide, please. And again, I want to revisit this idea that we want to operate on what is a Swiss cheese model. And I've been hearing in the discourse that this is kind of getting lost in the public because we're saying, oh, we have new tools now, we have to get rid of the old ones. And that's not the case. What we need is to add each of what's available in terms of measures onto one another. And that helps to cumulatively mitigate the risk especially in schools. And yesterday in our conversation, next slide, Chad, I think what we can reimagine to make it a little more palatable for the public is, maybe we have to readdress this model as layering for the extreme cold, because in Alberta, at least in Edmonton, we are in a deep freeze. So would you go out into the cold, say you got a new toque? Okay, it's great that you have a new fluffier toque that's insulated, but are you going to now forego all the other layers that you had on your torso, on your feet, on your hands? No, we need all of these additional layers. And even if one is improved, it doesn't mean that you get to dismiss the other areas, because that means pockets where transmission will still happen. Next slide. So here's the list, and I try to, be concise and succinct, but because schools are such dynamic environments and we've neglected them for so long, we do need to look at this in multiple angles. So the number one thing, of course, is limiting community spread. Next, testing, tracing, isolating. Third, the environment, the learning environment, the work environment, PPE. Four, it's data transparency. How much do we actually know about what is going to be happening in the schools once they open? 5 is more education adjacent, but it's about the human supports, family supports, and also staffing contingency in the school environment. And last, that is perhaps something new that we've added, is a vaccination campaign and increasing access. So I will go into these in a bit more detail now. Next slide. So first, we hear over and over again, the CMOH always says when school cases go up, that schools reflect community spread. Yes, indeed, that of course is true. Schools are the community hubs of every community, every neighborhood. That's where children go to congregate to learn, and that's where a lot of the needs that are in the community are met. But we also have not done anything to mitigate community spread before we opened schools on Monday. We didn't put in, restrictions for large gatherings enough. We are still seeing high community spread. CMOH just said that community transmission rate is the highest it's ever been. So how can you say that schools are just going to reflect community spread and then do nothing about community spread? We, I think, all along should have been prioritizing schools because they are essential, and foregoing the non-essentials in other aspects of the community so that children can have their stability, basic needs met at safe schools. That's not the point of contention. It's more, what has the government done on the other side of the lever to lower community spread? Next slide. So testing, tracing, and isolating, of course, was a big topic in the summer, and I'm not sure a lot of parents were in the loop about how much the contact tracing was eroded, unless you were in one of the schools where you got a notification, but it didn't tell you much. It just says no one has to isolate. You don't know what class it's in. You don't know if your child was exposed. So what we should be doing now, if we are going to make schools safe, we need the tried and true default protocols of contact tracing, reinstating class-wide and school-wide AHS back notification, because teachers and admin shouldn't be doing the bulk of this work. They are not public health workers. Notifying close contacts, even just letting the people that were in the closed classrooms know where there was a rapid test positive report. That will help with mitigation and also helping assess the public risk profile. The other side is, I think that we do need to continue PCR testing. They need to redeploy some resources, because we need to put what we have in official documentation. So this will have legal fallouts for parents that need to take time off to, help their kids at home while they're isolating, and just so many ripple effects of taking away PCR testing that RATs will not replace. And the data transparency is one key factor of not being able to track outbreaks in schools anymore because it's not open information. Next slide. And now one big piece, of course, I will reiterate, is COVID is airborne. And we did see the education minister do a dance, today on the presser, that they did what they could by moving some money around. I will be the first, I guess, to debunk that here, that a lot of the capital reserves that school boards had were already drained for the refunding or defunding of operations. So in reality, the reserves were not allocated for capital maintenance and infrastructure upgrades. So really, that's hand waving for them to say we told the school boards to do what they had with beans, and the government still has not addressed ventilation, filtration, purification, and we've had other presentations like by Connor Zicki that discusses what we need in terms of the technical upgrades in classrooms. And again, none of that was addressed today at the announcement. That is a huge piece because transmission of COVID in the air occurs when students take off their masks to have lunch, when they have snacks. Sometimes you're going to have sliding off the faces with the young children. And one group that I want to plug here that's been doing some great grassroots work in terms of public education about air filtration and ventilation in schools is Fresh Air Schools Alberta. So look them up for more information. Next slide. The other key aspect from a policy angle is that going back to schools, K-3 is exempt from masking still, which really negates the whole idea that they're trying to give out these surgical or medical grade masks. When you have an entire sector of elementary schools that are exempt, you will have school board inconsistency. So we had that in the fall. You're still going to have pockets of unmasked children in schools. I'm not really sure how the government would explain this inconsistency because they're just performing right now in terms of the masking situation. All right, next slide. And I'll just go through, again, the seal and fit of a mask is very important. And loosely sealed, even if they call a medical grade mask, is not going to mitigate transmission as much as it could be in the classrooms. There's already a lot of data out there, and I'm just going to acknowledge briefly that N95s or respirators are an important piece to this puzzle that this government, again, has not recommended to school boards and provided expertise to guide school board trustees in making these changes. And this needs to be a central distribution of knowledge because downloading to school boards is not going to be helpful. Next slide. And, Dr. Vipond touched on this, but again, every school letter that we've received as SOS has, there's a case in the school, but we are mopping the floor. We are wiping the tables, and we are here every wave trying to say that the hygiene theater needs to stop and the resources must be redeployed to mitigate airborne transmission. And again, policymakers are very hesitant because it is costly to pivot this narrative, but we will be back at square one if we don't change our ways and stop the hygiene theater in the school classrooms. Next slide. So again, it's not going to be easy to know what's going on in schools because the government actually they stopped publishing cases or notifying individual cases. They pivot in the fall to outbreaks, and they keep changing the goalposts of what an outbreak is, how many would qualify for in school or scenario change. We need information. Having a black hole of information is going to be problematic and also very concerning because we won't have any accountability as to what is happening on the ground in schools when we reopen. Next slide. And one avenue that we also want to advocate for is that when there are scenario changes because of mass spread, which is inevitable in schools that weren't made to be safe, we need the government to step in and provide financial support and mental health support for families that have been through this pandemic for 20 plus months. They continue to negate the idea that schools have these alternative support gaps. And what I think that we really need to push is that putting schools online or even going remote learning for a week or two is hard on families because you've taken all of their help away. Even now, employers, I think, are less understanding of the situation. There are no more federal supports, paid leave. We need a consistent, comprehensive approach that addresses this as well, because schools are not standalone islands, and families have been left out of a lot of these, multifaceted resources. Next. So lastly, I want to say that we should have been taking this time to do a booster drive. We bought a week in the delay. What was the government doing in terms of increasing uptake for children aged 5 to 11 for their first doses, or changing the interval if necessary for certain situations? Just something to acknowledge that we have really low intake for children in this province, but also boosters for education workers, making them accessible. They were not available at schools before the break. Why don't we try that? Why don't we also bring the public libraries in the fold, recreation facilities? Other provinces like Ontario have these, community collaborative projects to roll out vaccines, make people know they are safe, make people know that they're important and they're free. We just have not done any of that. This province has been extremely behind in terms of awareness, and that is something that we could have been doing with the time that we bought. Next slide. And that's it for me. I know that was lengthy, but I felt like we really needed to paint the picture that the government refuses to acknowledge, is that we have all the tools. We've tried door one to keep schools open. We've tried door two, which is close the schools when things get bad. We need to try this time to open safely with all of the measures, and some that I may have even missed from other angles, such as, workplace hazards and, other community supports that I haven't brought up. But it's time that we try door three, and that's to open safely. And unfortunately, without that, we will be back here with mass school closures, unfortunately, because Omicron will be ripping through the schools without these much needed measures. Thanks.
Thank you so very much, Dr. Lee. We are also so excited about, we're so cold, or who knows, been living in a polar vortex for so long, that one of the Protect Our Province team members also created a graphic that we will continue to build on as we are curious as to whether or not the Swiss cheese model has fallen through in some ways. And when it is, minus 40 with the wind chill, it is easy to think about whether or not you should be wearing your underwear when you're outside, with your long underwear over top, and then your pants over top of that, and then your snow pants over top of that. And again, it is very concerning that 3 years into this, we don't have policies in place and funding in place to allow everyone access to a toque, or mitts, or whatever piece of that puzzle it is that is going to keep our tiny humans as safe as they can. As we move into our panel conversation, I'm going to bring Dr. Vipond back up just to briefly touch on pediatric hospitalizations, and then I'm going to bring the rest of our panelists in to take some of the gazillion questions I have. Dr. Vipond. Dr. Vipond, you are muted and semi-frozen. Now you are unmuted.
Can I just start by saying how amazing support our students have been? I think every Albertan who has kids and who cares about kids should support our students, because they've just been incredible advocates throughout the pandemic. And I don't think it's incorrect to say that almost everything that they recommended here, maybe except for vaccinations because they weren't around a year ago, when we were Mass for Canada, were advocating with support our students a year ago. So that's where we've gotten in the last year. The other thing I wanted to add is that the graphic was a brainstorm of Dr. David Keegan. So let's give him some credit, because it's really quite genius, the fact that we need all the layers when we're out there, not just one or two layers if you're going to be warm when you're shoveling snow. And then the last thing I wanted to mention to Dr. Wing Lee's announcement is that the double dose rate for the 5 to 11s is 4%. So I just want everybody to think about that. We consider full protection from Omicron 3 vaccines. 4% of our 5 to 11s have had two vaccines, only 4%, and then somewhere around 40% have had one. So not so good. Okay, so the reason why I wanted to come on is because late breaking news. I mentioned the hospitalizations for the last week up until yesterday. In the last 24 hours, there have been 13 pediatric admissions, including 3 to the ICU, and that is a huge number for kids. So really worrisome data. We know that Omicron tends to affect kids worse than other age groups, and I think we're now seeing evidence of that. So back to you, Michelle.
Although you still have to stay because we're going to get into our panel conversation now. So I'm going to bring back Dr. Wing Lee. I am also wanting to offer an exceptionally warm welcome back after a while to Bridget Sterling, a PhD student at the University of Alberta's Department of Educational Policy Studies, where her research focuses on children's rights and the politics of childhood in Alberta education law and policy. She recently has been working on childhood and COVID-19 policies in schools, and up until partway through the fall, she was the Ward G trustee on the Edmonton Public School Board. Welcome back, Bridget. Thank you for giving us your time today. And a first time Pop AB welcome to Dr. Joseph Oliver. Dr. Oliver is an Ontario-based pediatrician here to answer a lot of the questions that we've been receiving from parents about COVID and kids. He's also spent the pandemic working tirelessly bringing vaccinations into underserved communities in Ontario, creating awareness and advocating with Masks for Canada to keep all Canada safe from this airborne virus. First time welcome to you, Dr. Oliver. Thank you so very much for making time to be with us today. There are a lot of questions from folks at home. I know there is no way I'm going to ever get through all of them. So I'm going to dive right in. You are all grown humans. Mute and unmute yourselves as you see fit. Scramble, go to some fisticuffs. We'll find some positive weird energy, if nothing else, so people listen to jump right in and express your opinions and answer the questions. First and foremost, as Dr. Lee said, this is the 3rd school year with interrupted learning for our tiny humans. And in Alberta anyway, we seem to be following the same path into learning, this time with the added barrier of access to proper testing. There's no tracing on the part of AHS. We have shortened isolation periods for the majority of Albertans. And with what we've heard from officials, can any of you see anything meaningful in place that will allow our students to make their way safely into classrooms next week? The silence is golden.
I'll jump in. I guess I would just preface this with, I work in pediatric mental health in Ontario, and one thing that is bearing out on the ground today in Ontario, where we have also delayed school by an amount, is that the young people I meet with are devastated to not be in school. And while the parents I meet with are similarly devastated, they're also terrified of sending their kids to schools without them first having implemented the things that Wing went over, the airborne precautions. And so the question, can I see any hope? I think the awareness, I haven't joined these before, but listening to Wing's talk and listening to folks on social media, and I think there's an awareness of what's needed, and that has started to permeate throughout communities, certainly in Ontario, and I suspect they're in Alberta. And I think some fear, and not unjustified fear, on the part of parents and on the part of teachers and on the part of kids. Kids are smart, is starting to creep up. And I'm hopeful that will push things to be done in schools there. The timeline is tight. And I think there's no harm whether you're someone who wants school to start now or yesterday, or someone who wants school to start in months or in a week. There's no harm in pushing aggressively and using that awareness to push schools, boards, your government to implement the things Wing was talking about. So I see the awareness.
Yeah, and if I could speak to those delays, like one of the things we keep seeing in terms of impacts on kids is that every time we keep having these delays in starts of schools, or we go offline, or we go online for a while because things are getting bad, and we don't use that time to do anything meaningful. And so what I see over and over again is that we're continuing to do, but I think, there is harm in sometimes in having to go online in terms of learning loss, mental health, all of these different pieces. But there's kind of a benefit that we could be getting if we were, taking action to make the changes when we're offline. So we bought ourselves a week in Alberta, and we did nothing with it. We're not even going to have those masks and rapid tests in place for Monday when kids do go back to school. They're going to be delayed another week, and it sounds like the masks aren't even all going to be delivered in that week. What I'm seeing is that the minister says they'll be coming through February. So, we're not even going to see those inadequate masks in place. So we bought a week and we did nothing with it. And so we keep doing this over and over again. We did this in the summer. We could have done so much work over the summer. Nothing happened. And so we're back in the same place again. And what do we have to show for every time we put kids back online? We don't do the things we need to do to get the school safe when they come back.
Which leads really well into one of our other questions that we've heard from a number of parents is the government, Minister LaGrange, as well as our Chief Medical Officer of Health and Premier Kenney have often stated that schools are safe and that they are not a source of community transmission. I would love, from a medical pediatric standpoint, Dr. Oliver, as well as what the rest of the panelists have experienced in their practices, their thoughts on whether or not schools are a source of transmission.
Maybe I can just speak from a stats perspective, because I follow these numbers pretty closely. And if you look back at you can just pull it up right now, go right onto the Alberta government website and look at what happened to transmission rates amongst the 5 to 11 age group starting around September 1st and going through to, around December 20th, and see what happened with that curve. And you can make your own interpretation of that. But my interpretation is schools drive pediatric infection. And then closely following those pediatric infections, you see rates going up in the 30 to 49 age group, which is, maybe the parents of these 5 to 11-year-olds. So I see a clear footprint of school transmission, and that school transmission is goes back and causes community transmission. So I don't know if anybody else wants to weigh in on that, but I guess it makes me really upset, because I honestly think it's kind of a bald-faced lie. And if the government feels okay with spreading that kind of information, it's no wonder that school boards wonder what to do when they're getting, information like that, and parents.
Yeah, and we don't see the tracing beyond. So we saw actually in today's news conference, Dr. Hinshaw talk about how there's, average when they've tracked school transmissions of 2 additional cases, but they're not tracking it past that, right? So as soon as it gets into the home, they start putting that in the household spread bucket, right? When it gets into community, say it happens at a child's sports team after they've acquired it at school, that's now considered community transmission. And so what we're not seeing is public reporting of those kind of clusters that spread out from schools. And there's some research now that's coming out that you're seeing where they have done the work to trace cases from school sources, and they've looked at where the clusters are coming from around schools, school populations. And it's very clear that clusters often are starting in the school and spreading out into the community. But because Alberta doesn't keep those in the school related bucket, they can say that schools aren't a driver of community transmission, because as soon as it's outside the school, they call it household spread.
And I would just add that this semester, I'm not sure how they can back up that conclusion without having contact tracing in place in the first place. So not having the evidence does not mean that there's lack of evidence for something, right? Just that we weren't watching or monitoring, and then they jump to the idea, or it's conclusive, it's not happening, we just weren't tracking it. The other thing is that because we do track, school outbreaks as an organization, absolutely, there are communities that once it's in one school, we do see that pattern over and over again, that that school district encounters clusters in multiple schools in that region or in that city. And just before we left for Christmas, we had St. Albert and Okotoks. Their elementary schools were really struggling. And when you put it together, there is the trend that one school contributes, yes, but it's a feedback, community to school, school to community. And I think isolating them in black boxes is not helpful, the way that the government is trying to split those hairs.
Thank you. I'm just going to keep the questions coming because we do have a lot of them. Some questions around whether or not the panel thinks with no extra mitigation measures put in place besides the RATs, as well as some possible access to probably ill-fitting surgical masks, should kids still be able to remove their masks when sitting forward and not talking like they currently can in the system? Obviously, K-3s in some divisions are entirely exempt from wearing masks at any point. And should students remove their masks during physical activity, so during phys ed class, that sort of thing? Medical recommendations from the panel?
So, caveat being there are always exceptions. Should students remove their masks when they're sitting forward, not talking? Presuming that they all need to breathe, my suggestion would be that they should not remove their masks. And also that for the most part, kids wear masks quite comfortably. There are occasionally neuroatypical kids or kids with sensory issues that have difficulty keeping a mask on, but not always, because we shouldn't assume or think just because we wouldn't want to wear a mask, a kid might not want to, but they can keep them on. And that extends to sports as well, again, with exceptions. We went to, before Omicron started, skipping around, we would go to soccer games and soccer tournaments. Many kids wearing masks. We know that kids, certainly kids 2 years and over, can wear masks comfortably. And what works out nicely, I'm just going to plug here, what works out nicely is that some of the more comfortable masks that I would say kids are able to keep on more willingly, more easily, are the respirators, the N95. So these masks, if I'm a kid in a classroom, I'm having a hard time keeping this on because of the way it sticks to my face and shifts around and comes down off my nose, whether I want to or not. This mask would be an example of an N95 respirator that, if accessible between now and when school is starting, on the face of a child, like, they're quite comfortable. And I've noticed, not necessarily just in Alberta, but Canada-wide, there is a narrative that keeps popping up that is, kids can't wear N95 masks comfortably. They're comfy as all get out, I would say. And they can be worn in sports. If you're wearing them in sports, you might have to change it because you're sweat wetting it. And once a mask is soiled or wet, it loses its effectiveness. But absolutely, they can wear them with exceptions.
The public may be wondering why this narrative that N95s aren't comfortable, where it came from. There's actually a good reason for that. The original N95s are these cup-shaped masks that pushed really hard into the face in order to ensure a seal. And they are quite uncomfortable. I would find it hard wearing one of those through the duration of a school day. But the newer masks they're called soft folds, and soft is probably the most important thing. And they kind of go broadly across the face. And my kids wear them all the time. They're very comfortable. There's also the KN95s. I found my girls really like the KN95s because it doesn't go. Something about hair, I don't know, that the band goes around the ears instead of around the head. KN95s probably aren't as effective as the N95s, the respirators, but they're much, much better than the medical masks that are being provided. And with the medical masks that are being provided, if people are having a hard time getting respirator masks, they can get a mask brace. It's like a rubber ring that it pulls the mask onto the face, because the concept behind these masks is that you don't want air going in and out the sides. There's nothing magical about the fabric. Yeah, Michelle's going to monitor the mask nostrils that you'll see coming in the sides. They're just not designed for the air to only flow in and out the mouth. They're actually designed to keep the surgeon from spitting into the patient, or alternatively for the patient to be spraying blood into the surgeon's mouth. That's what they're designed for. And so if you want to make that surgical mask that your kid might be provided, you want to make it effective, you need to get one of those mask braces. And there's actually online tools that will teach you how to make one at home with your own equipment. So
and we'll tweet some of those out later today. I was watching one yesterday that was legitimately a template that you could cut out on a piece of rubber. You line it right up, and it made a lovely template. And pointing out that most of the videos that were made around that were made in 2020.
Can I add a thing, or do we have to move on to another question?
No.
Yeah. One thing I get asked a lot is, parents are trying to figure out, how do I get my kid to wear the mask? And maybe you've spent, the first 74 waves or whatever of COVID navigating that, and it's been hard, and maybe it hasn't gone well. But you could use this as an opportunity to start fresh. And one line that seems to work fairly well is validating them, and then just framing natural consequences positively. So what I mean by that is saying, if your kid says they don't want to wear the mask, you could say, you don't have to wear the mask, but if you do, you get to do these things. Or you don't have to wear the mask, but if you do, school might stay open longer, and explain things that way. And while we shouldn't put the responsibility of fixing the pandemic on our children, at the same time, they want some power back and some control back in a pandemic that's taken so much, and that gives it to them. But that line is sometimes useful.
Speaking on tiny humans and their mental health and well-being, and giving them some of that agency, we received a couple of questions around this far in, but with cases across the country being so high, and with 25% of those cases in Alberta anyway being in tiny humans, what are some tools for talking to your tiny humans about the ongoing pandemic without scaring them? And so particularly those younger ones, of wanting to instill that, this is still a thing and it sucks and I'm real sorry about it, but wanting them to know that there can be negative outcomes if one's not cautious.
Some people may know that I have a little bit of a climate advocacy bent. And so I've read quite a bit on this, on climate, because it's kind of the same issue. There's a big, serious problem that is hard to fix and may have impacts on your life. How much do you share that with your kids? And the truth is, from my understanding, is you have to share the truth. Kids have a really huge bullshitometer, where if you try and skirt the issues, they may not take well to that. I'd love to hear some other people's opinions, but basically being open and honest and saying there's things we can do to make things better are the three things that I think people should be doing.
I agree, Joe. I think a question on pediatric board exams in Canada should be, how strong of a bullshitometer do children have? Absolutely. So I would say, yeah, same as with the mask discussion, what Joe's saying, validate them, be honest, and occasionally check in and see how much of your own anxiety you're projecting on your kids. And also know that you don't have to get conversations right with your kid the first, second, third, fourth, fifth time. You can always repair and take another run at it. And that's totally fine, and it works. So some things I would consider saying are, the virus is spreading again. So to keep people from getting sick, the helpers are helping, and you can look at how the helpers are helping. You can select kid-friendly interpretation or presentations in the news. You can look at individual helpers, stories online with your kids, that sort of thing. And you can frame it also as, yeah, this sucks. Also, here are the ways we can have some power and control over things. And all the while just validating their emotions instead of saying, don't worry. You can say, it's okay to be anxious. Here's what we can do. And they respond well to that. And it's easy to sit here and say these things. So I would certainly add, if you ever want to see someone trying and bombing it the first time or two, I'll give you my address. You can drive by and look through the window and watch my wife and I not hitting it right on. But that's fine. You don't have to get it right the first time. You can take another run at it, and you'll know when it lands and when your kid gets it. But yeah, they have a strong meter for the BS for sure.
Bridget, I would love your thoughts on this question as well.
Sure, and I guess I might speak to it from someone who thinks about the politics of how things, and actually another area where I've kind of looked at this, and I feel like I've got some commonality with Dr. Vipond here, is in climate change. Is I really think that ability to participate and feel some empowerment is really important for young people. And we see that a lot around issues like climate change, and I think around the pandemic too, is feeling like there's something they can do is really, really, really important. But also, I think it's really critical to remember that, they have a lot invested in the outcomes of these things. And that's really important too, to remember that kids do think about the future. They do think about what's going to happen. And we have to, recognize and support their desire to participate, both in I think in the concrete actions in the classroom, but even especially as kids get a bit older, in some of the advocacy work and some of the conversations about it as well, right? We see young people being really powerful voices on climate. And I think around COVID-19, there's probably some role that young people could be playing too, and talking about what makes them feel safe in school. Because we know from the surveys that we did with Edmonton Public, for example, that the kids actually did say that wearing masks made them feel safer in school, right? That actions that they could take made them feel safer. And I think that's really important to recognize, as that's important for them in terms of their feelings of security.
Can I add so I know there are a lot of questions, but I'll along those same lines, Bridget. So my kid's teacher took one of these. So this is a carbon dioxide monitor. Remind me, it's a carbon dioxide monitor, and you can use it. You'd have to knock off a bank to pay for one. Don't knock off a bank, but they're expensive, so that's a whole other thing. But my kid's teacher had it in the class to keep track of how well air was moving out of the class, and she to get a sense of COVID being airborne. Is it lingering in the air in our class so that the kids will breathe it in? Well, if we know we're keeping the carbon dioxide in the room down, we know air is shifting out of the class, and so there's less of a chance for kids to breathe in COVID. The kids all got so into it. She framed it in terms of, like, it led to a whole unit on plants and carbon dioxide and oxygen and all this. So you can really, absolutely, you can involve kids so much like that in a very empowering way.
Which leads towards sort of our next question, actually, that I might throw
Michelle,
to. Oh,
we just want to point out that Protect Our Province Alberta does not endorse robbing banks for CO2 monitors. Okay.
Sorry.
Okay, I will agree that we don't endorse robbing banks in order to purchase CO2 monitors, but I will throw in, stay tuned to our various social media platforms over sort of the next week and a half, because there's a very good chance one of the Protect Our Province members has created a DIY CO2 monitor, so you can make one without having to rob a bank. So it's kind of a, it's a half and half. I'll go with both there if that works. But that being said, it is absolutely ridiculous that time and time again, these mitigation measures are falling on parents and teachers in order to try to keep these tiny humans safe when they are participating in their public education and their right to have it and to be safe in those environments, and the workplace health and safety component for all of our educators who have been bending over backwards over the last 3 years. Dr. Lee, we have had this question before, but it's just going to keep coming up. I know it is. Who do parents talk to? Because I'm seeing left, right, and center that they are not feeling good about Monday.
Yeah, absolutely. And I would reiterate, that's totally normal to feel like you're caught again in the same place, no movement, no change. And I think now, it's important to talk to one another, because we see these kind of pockets of parents talking and normalizing the idea that they need to help the voices, right, that are already out here. And we want to grow that movement of pushing pressure onto the government and the policymakers and the leaders, that this is not just groups of radicals, this is not just groups of partisans, and they like really to pocket these concerns as just interest groups. We need to grow the awareness, just like Dr. Oliver mentioned. Is I think we've done some work in moving the needle through this collective, but I think one resource that parents could tap into is their parent councils. And I know, like, asking more parents, like, what resources do we have left in terms of energy and time, but I think that does help move the people that aren't listening. Oh, this is growing, and getting even the airborne idea, into normal public discourse, mainstream discourse, is one of those stepping stones. So on top of, talking to your trustees, pushing them, their superintendents, they have limited power within their scope, but it needs to escalate. We've got an election coming up. Just remember, we can't forget that we need to be electing accountable, responsible people that believe in science. So it starts in our communities, in our neighborhoods, and moving up from there.
Bridget, I've heard some really good things about what has taken place over the last year and a half from the Edmonton Public School Board in terms of them educating each other and themselves around best practices for mitigation. What were some of the things during your time there that helped you, your colleagues, your school community, and then ideally bringing that up and further out there, become active in seeking that information?
Yeah, for sure. And there's a few things that I think were drivers there. One of which is that we certainly had a couple of trustees who really pushed the rest of the board into wanting to learn and work on issues. Sometimes finding that key person on a board who can really push things can be helpful. And then, I think also the demand from parents and from our community was really, really important. And also, the voices of experts, and I don't mean just, I think it can be really easy to want to write letters, but I think showing up, speaking to meetings, we had some folks, and actually some of the Protect Our Province folks even, who took the time to sit down with trustees and really answer some of the complex questions that people had, because trustees are decision makers, but they're not experts in public health or ventilation systems or these different pieces, right? And so it's really important to help people learn. But there are forces that push the other way within education. It can be really challenging. Education has an inherent sort of small c conservatism to it a lot of the time, because we're talking about children, and children are, we're anxious about taking risk when it comes to children, right? That's a really natural feeling for people. So there's some hesitancy there. Also, the many other things that school divisions are dealing with in Alberta right now compounds the problem, right? So when trustees are dealing with a pandemic, but they're also dealing with an absolute nightmare of a curriculum, they're dealing with massive funding cuts, they're dealing with all of these different things at the same time, it becomes really, really challenging to sort of manage all of these issues and advocate on all of them. People are really tired, and they're also fighting forces within their own boards. So we've got, we even had in Edmonton Public, right? We had, anti-vax COVID denialist trustee on our board. Other boards have much more predominance of those groups, and that's really hard. And even for trustees on those boards who are really, really wanting to push the envelope and talk about COVID safety in some communities, I heard from trustees who are experiencing threats of violence, those different things, who are really scared to act because there was some real sense of unsafety for them in taking action. But that's where I think coalitions with parent groups, with Alberta School Councils Association, Support Our Students, but also the ATA, these different bodies that have historically sometimes butted heads with each other. And it's really essential right now that we're organizing across those groups, because that's what gets people mobilized, right? It's not one group. And it has been, parents have really carried the bulk of the weight of this. And, it is really accurate. But I think we need to see those coalitions being built more strongly. And we've seen that happen a lot, probably most strongly around curriculum, but we could be doing more.
Before we go into our final thoughts, comments, and summations, one more medical question that I would really like to touch on. Dr. Oliver and Dr. Vipond as well. Folks would love to hear your comments on accelerating second doses for 5 to 11-year-olds down from 8 weeks to sort of that 4 to 6 weeks in light of the virulence of Omicron and going back into schools on Monday with minimal protections. As Dr. Lee mentioned at the beginning, and I believe Dr. Vipond did as well, we were at about 4% of the tiny humans double vaccinated. And and I think a lot of the folks in Alberta know that they can choose to have their tiny human vaccinated pre that 8-week window, but just wanting to sort of your guys' thoughts and opinions on the trade-off of going down to that sort of 3 to 6 weeks from the 8 weeks.
So the initial advice from our National Advisory Council on Immunization for vaccinating kids 5 to 12, 5 to 11 and 11 months was drawn somewhat from work from the vaccine rollout in the States. And it was suggested that we do that 8-week window in between. Those kids getting vaccinated in the States that were done at 21 days, 3 weeks between vaccinations, if there are bad outcomes, maybe Joe can speak to this, but I'm not aware of it. One thing I think about all the time is the fact that in medicine, every 25 to 50 years, we look back and look at things where we thought, oh, we had that wrong or we had this wrong. And I think about that a lot. I think about that when it comes to vaccinating kids at 21 days, and it still does not make me think twice about doing it. We vaccinated, I'm one story, but we vaccinated our 7, now 8-year-old at the 21-day mark. Maybe you can hear him crying now. It's not from the vaccine. And that was because, well, waiting 8 weeks is the suggestion because maybe it gets you longer lasting, maybe stronger immunity. There's COVID now, and we don't know enough about Omicron. We don't know that kids will be safe. You heard Joe's numbers at the start, the admission numbers for kids. We're learning about long COVID all the time. This idea that kids can have difficulty thinking and processing after infection with COVID. So for me, vaccinating my kid at 3 weeks out was a no-brainer. A lot of thought went into what was a no-brainer.
Are you on the same page there, Dr. Vipond?
I've actively avoided learning about immunizations, not because it's not interesting, but because my brain only holds so much information. So I've really tried to focus on airborne transmission and COVID policy. But if I'm just going to randomly throw out a fact, I think it's that there have been, if not no, at least very few cases of myocarditis, and that which seems to be the most worrisome side effect of the vaccines in that 5 to 11 range. And there's lots of evidence that there's much higher rates of myocarditis from COVID than from the vaccine. So avoid COVID, basically. And so I would echo Dr. Joe's recommendation.
I would add, I've got colleagues who, Joe and we have colleagues that would advocate the opposite. There's a few around the country, and so that makes me think, oh, do I have it wrong? But I don't believe I do. It's an annoying decision to this pandemic. We make so many annoying decisions as parents every day, COVID aside. So this is just another annoying one, and COVID's being very pushy with the timeline. But I think okay, even if I'm hesitant about getting my kid the vaccine, gosh, I'd rather be wrong about, I'd rather, wonder, should I have gotten them that dose of vaccine than wonder, oh my gosh, now that they have COVID, unvaccinated or half vaccinated, what are the outcomes of this going to be? I guess what I'm trying to say is if you're hesitant to get your kid vaccinated at 21 days, that's fine. And I think a lot of parents feel that. But if the purpose of vaccinating is to protect our kids from COVID, well, there's no better time to do that than with all the COVID raging around right now, including with kids going back to school with what I understand are none of the precautions, or virtually none of the precautions that Wing outlined in her talk.
And Dr. Joe, correct me if I'm wrong, but the Pfizer study on the 5 to 11 range was a 3-week interval between vaccines, right? And so this recommendation from NACI, I think, is due to some caution that they're putting forward. But the actual scientific evidence supports a 3-week vaccine, because that's what we're basing our...
Yeah, that's my understanding of it. The 8-week caution from NACI, I don't sit on the committee, but I suspect it is related to the incidence of myocarditis in the 12 to 29-year-old range. The U.S. study that included kids from all over the world included 21 days. It also included the adult dose. And to the best of my knowledge, last I checked, did not report anything concerning from that dose. But they also found that kids only need a third of that adult dose.
Thank you all so very much for your time. We still have thousands of questions. We are not going to get through them all. So I would love to give an opportunity for each of you all to give some of your takeaways for what is a very nervous parent and education community that is going to be facing classrooms of 33 students that don't have consistent masking regulations, that have kids eating in their classrooms, that will not be made aware necessarily of positive cases in the spaces, and will basically be left with not exceptionally well-fitting medical masks, and maybe some rapid tests, maybe these things appearing 5 days into our winter break school year starting. So maybe to start with you, Dr. Vipond, and then we'll go over to Dr. Lee, Bridget, and then conclude things with Dr. Oliver before we say our goodbye.
So through the pandemic, we've had these myths that have been promulgated by our leaders, and the ones that come to mind are there's no asymptomatic spread, there's no airborne transmission, and there's no transmission in schools. But there's been a fourth added in the last few weeks, and that's I find really disturbing, and I want to fight it. And that is, everyone's going to get it. Everyone's going to get COVID. The language used yesterday by Dr. Hinshaw was everyone's going to be exposed to COVID. But I think the implicit communication there was we're all going to get it. And I don't believe that. I believe that if you know how to mitigate spread, you can protect yourself. So what does that mean for kids going into schools? I think it means essentially wearing the best mask possible. Because this is an airborne transmitted disease that needs to be inhaled, you can protect yourself by avoiding that inhalation. So make sure that your mask fits. I would, again, surmise that the masks that they're going to be provided are not fitting. So go get some good fitting masks, or build yourself a mask brace for the mask that you're provided. And don't take that mask off when you're in school. There's one trouble part for that, and that's lunch. And I don't have a good answer for that. But I challenge our very smart people, our educators, as to figure this out. This isn't a public health problem. This is a logistical problem. Staggering lunches, putting ventilation systems, multiple into a room where there's multiple kids eating, spreading them out, making them eat outside. If it's half decent, if it's -10, hey, it's outdoor lunch day today, kids. Taking your kid home for lunch, if you live close enough to the school. Those are all some options I'm just throwing out, and I bet you there's better options out there as well. The if it's true that they've given up and expect us all to be infected, your purest act of rebellion is to not get infected, or to try your damnedest not to get infected. And let's be honest, we may fail. I think none of our systems are perfect, and when the kids go into that school place, they don't have, we can't protect them from everything. So there may be failures, but damn it, let's try, and let's try and keep our kids safe.
I'll go next then. One thing I'd add, I feel like I've already said a lot of my talking points, other than that this government is continuing to be absolutely reckless and absolutely negligent. That's my official reaction to today's announcement, continuing to make students pay in this pandemic. The other thing I want to add is that teachers and education workers have absolutely come out. They have carried these past few years with taking on extra work. They were already underfunded as it was. And that's what I want to finish off with, is that acknowledge these people working in the schools that have done what they can as workers, but also doing their best while teaching. I think it's incredible that they continue to come and show up on a notice, very short notice, with lesson plans, as well as helping students stay safe, and as distant as they can, and all of those things. So I guess my message is of gratitude for all the education workers that are on the ground and will be going to the ground, is that we continue to push for you for safer workplaces, as well as safer learning environments for students.
Yeah, and I don't think those people have had really a good rest since March of 2020. And I can't believe sometimes that the way people are still standing up under everything they're facing right now, COVID and all the rest of it. One thing I do want to say is I have a lot of people ask me, what should I do? Should I send my child back? Should I stay home for lunch? Should they eat lunch in school? What do we do? And I think every decision on that's an individual decision based on, what works for your family and what works for your child. Some kids do better learning remotely than other kids do. Like, there's lots of different factors there. But we are not going to be able to individual choice our way out of this. Like everything else with the pandemic, what we do as individuals matters, but it will not fix things, right? It is our collective action as people that will address the situation in schools, right? So absolutely, as a parent, make the choices that you feel are going to be best for the safety of your child and your family, but recognize that not every family maybe has the ability to make the choices that you do. And that part of our collective responsibility is to advocate so every single kid and every single person who works in the school has their safety protected. And so whether or not you can choose to go home, it's still really, really important for you to raise your voice for all of the people who are still going to be going into that school every day, because they need you to stand up for them. And those kids really need all of us to speak for them. And they need us to be in solidarity with everybody who's working in schools, making sure that those kids are safe and that they're learning and that they're getting the best education they can in one of the toughest times they'll probably face in their lives. So.
I really wanted to come in with something novel and profound here, but I want to echo what Joe and Wing and Bridget have said. Absolutely. I was in Teachers College for half a day years ago. I thought, no, too hard, and left. And so, but from that, I still have these connections over the years where I see teachers like that. It's always been the thing with teaching where you buy your own stuff, you buy your own markers and pencil crayon and everything. It's out of pocket. And now all these teachers and colleagues and friends and teaching are going around, and now they're thinking, well, now I have to buy my own N95s, and I have to, buy my own HEPA filter and that. And so it makes me mad that this is my mad face. It makes me mad that the government is not mobilized to provide these things, not just in a timely fashion, but at all. governments across Canada. I also think, though, it is okay to celebrate what we can do on the ground now, and if you're sending your kid to school on Monday or whatever day, I would just encourage folks to, not that you need to hear this from me, but let your teacher know that you see them and you see what they're doing for your kids. If you have 25 respirators for kids, maybe you share one with the family that doesn't. Maybe you educate another family on the importance of them. There's a story from the CBC this morning about a principal in I think it was Edmonton. It was somewhere in Alberta. Principal and whoever it was, families in the neighborhood or something, decided that they were going to outfit their school with these homemade HEPA filters that work and work very well. And they went for it. They made them for all the classes. And while on the one hand, it should not have to be like that, on the other hand, I thought that was beautiful, because there's a lot of focus on kids, but I will I would say as a pediatrician, I think what really gets me in the feels is seeing all of the teachers mobilize, and maybe when they're being told not to, and the principals mobilize, and when they're being told not to, and I think that's just friggin' beautiful. But whether or not you, the absolute final thing I'll say, and I'll stop taking all the time here, is whatever you decide as a parent to send your kid to school on Monday or not, or next week or not, just know that it sucks having to make these decisions. They're annoying decisions, and for the most part, it is okay to deliberate on them and not always get them right, and that I think it's clear, but you are not alone.
That is an excellent statement to end on, as I strongly believe that is one of the primary purposes of POP Alberta, that concept of community and reminder that we are not alone. So thank you for joining us for this little bit longer but exceptionally necessary first episode of 2022. We'll be back again next week, maybe sooner. So remember to subscribe on whatever service you've been tuning in on, so that you can receive all of the notifications. We're going to be playing up this layer up concept as much as we can as we work towards safer schools and a safer 2022. Also, a shout out to Sarah B for throwing this graphic together this afternoon after the conversation that the POP AB team had last night. But as always, stay safe, Alberta. Remember, COVID-19 is airborne. Wear the best mask you have access to, and vaccines really do save lives.